This animation gives an introduction to costing for mental health in the NHS in England. We recommend that you watch our animation that gives an overview of NHS costing first, before delving into mental health specifics. Mental health services aim to improve mental health and well-being by providing access to a wide range of services and professionals. People who access mental health services are usually referred to as service users or clients rather than patients. Most services will be provided in an outpatient or community setting, or a mental health professional may visit a service user in their own home. Sometimes, service users will need to stay in dedicated inpatient facilities for all or part of their care. Services may be provided by a dedicated mental health trust, or by a combined trust that also provides other community-based services, such as district nurses and health visitors. There are a few examples of mental health services being run by trusts that provide hospital-based care for non-mental health users. This is called acute secondary care. An NHS provider may also work with organisations from other sectors, such as charities and social services, to provide a joined-up package of care. Just like all other NHS services, costing in mental health involves quantifying the financial value of resources and linking them to the activities that they are related to. Activities are defined based on what, where, and how services are delivered. For example, an activity may be to provide inpatient ward care, deliver psychological therapy care, or attend a home visit. Resources are defined based on the types of expenditure incurred in delivering each of these activities. In mental health, pay costs account for up to 80% of total expenditure. Hence, most resources are defined in relation to the staff that deliver services. Patient-facing staff costs would be classed as direct costs. Staff may travel between patient homes and other care settings, so travel costs associated with different activities also need to be taken into account. Other significant expenditure items may include prescribed drugs and other clinical consumables. If a service is delivered in the community, there may be premises rental costs to take into account, as well as other building costs such as utilities. These would be classed as facilities costs. There may also be costs associated with contracting out all or part of a service to another organisation, such as a local charity. Organisational support services costs would also be included as another type of expenditure, known as overhead costs. All of these different resource costs can be identified from an organisation's general ledger and payroll information. Linking the cost of resources to all the different activities can be challenging because you need to draw on lots of different information sources from across the organisation. However, the end result is a rich source of management information that helps you to understand the cost of a service or even an individual patient. Costing becomes even more powerful when the resources and activities can also be attached to individual service users. The Mental Health Services Dataset, MHSDS, is a key source of information to help costing teams to achieve this granular level of information. Information is recorded about the patient, the service, and professional or professionals that they interacted with. It also includes details about the setting where the interaction took place and how long it took. This approach to costing is the mental health version of patient-level information costing systems, or PLICs for short. PLICs is explained more in the overview of costing in the NHS video. NHS England now require all organisations to collect and submit PLICs centrally for all healthcare sectors. This is called the National Cost Collection. As service users are likely to have multiple appointments and contacts over a period of care and treatment, this patient-level approach enables organisations to see the cost at different levels. They may look at one patient across all services within a specified time period, or may look at all patients who access a single part of a service. This allows internal comparison and analysis, especially when activity and cost are considered side by side. For example, it may highlight that one client is regularly accessing multiple different services and flag the need for a joined-up approach to that individual's care. It may also show that more community intervention could avoid high-cost inpatient stays. Analysing the PLIX data for mental health is also a useful tool for signposting differences within or between services. It may not provide all the answers, but if managers are looking to improve efficiency, increase productivity, or reduce variation in care, it is a useful tool for determining where to focus time and effort. For example, analysis of activity and costs for different community teams within a single organisation may highlight variations in cost per domiciliary visit or per service user. This may signpost health inequalities between different locations and enable an organisation to look at how to address these. It may also highlight a need to address team size and skill mix, but it could also be due to unwarranted variation in the way that care is delivered. Prior to PLIX, comparison with other mental health providers was limited in value because there was not a standard way to allocate costs to services and patients. But now the National Cost Collection has introduced prescribed data requirements and costing standard, which can help organisations make comparisons between their services. Benchmarking against other trusts that provide similar services can highlight opportunities for improving financial stability, whilst making the best use of limited capacity and resources. Better costing information encourages organisations to look at the services that they provide through the lens of value-based healthcare, which focuses attention on the allocation of resources and how they are used to deliver the highest quality of care. As well as understanding the cost of a service user's full pathway in the mental health organisation, patient-level costing also means that patient pathways can be analysed across organisational boundaries. Working collaboratively across provider organisations and in partnership with integrated care systems presents further opportunities to increase overall value. Identifying service users who also regularly access other NHS, social care, or charitable sectors and organisations can lead to transformational change, which reduces the overall burden on the system and improves care. For example, a service user who is regularly attending A&E or calling the emergency services, especially if doing so during the night or weekend, may benefit from increased and proactive contact from the community mental health team. Understanding the cost of NHS patient care is vitally important, both locally and nationally, to make good decisions about how to manage and deliver sustainable, high-quality services. As we become more focused on health inequalities and on improving population health, the role of costing in mental health and all other provider sectors will increase in importance.